Lucky enough to have Jan Hochadel, AFT Connecticut president. I'm going to answer some questions. I had people sending me questions through the past couple days, so I've got a list of them she's going to work through. Hopefully we'll be able to run around with a mic to get questions answered through here.
I've been getting a lot of questions about what's going on with SEBAC, even as far back as last year, and we thought it would be easiest just to open this, have an informal discussion about what has happened and where are we going from here. So thank you to Bill and his team for setting this up. So let's start with last year. Last year, the administration did come to the SEBAC leaders, and they did want to open discussions for concessions. It was about this time, maybe a little bit later. It was a different attitude. What they were looking for was they wanted wage freezes. They wanted us to contribute more to our pension. They wanted us to contribute more to our health care, increase our co-pays. Oh, by the way, there would still be layoffs. So a couple of us said, and exactly how are we supposed to explain this to our members? What are you giving us in return? Oh, nothing. They should want to do this out of the goodness of their heart. So as you can imagine, we told them to pound sand. And that's why there was no concession package last year. So we were at a SEBAC meeting last week, maybe at the beginning of this week, and there were some members in the back of the room that were supposed to be observing, but they actually were starting to yell, yes, and we should continue to do that. Continue to hold the line. Don't have discussions. Nothing has changed. Well, friends, things have changed, right? November did happen. I don't know, something's happening today. It is happening. Reality has changed. And people say, well, what is it specifically? Specifically, what we're afraid of is there is a very good chance within the next 2 years that we will be a right-to-work nation. And I won't go into the specifics of what right-to-work means, but we will be starting to have these discussions specifically on when we go right-to-work, what will that mean to you? And we will have those conversations, I promise. But along with the idea of right-to-work comes the idea of losing collective bargaining. If we were to go right-to-work tomorrow and lose collective bargaining, that means they could impose anything they wanted on you as far as wages, hours, and working conditions. Anything that they wanted. You would just be like the private sector. What does that mean for SEBAC? SEBAC, we still have a contract that goes to 2022. So what would happen? They would have to honor that contract for pension and for health care until 2022. After that, again, all bets are off. Knowing that's our reality, there's a lot of folks that are saying, hey, can we push that 2022 further to maintain that health care and that pension that we know we want to keep? And can we do anything to get UHP a contract, maybe 5 years, so that we maintain what we have in that contract? And if the answer is yes, what are we willing to give up for that? And that's why we've been having exploratory conversations with administration. I will be clear, we are not in negotiations right now. We are having exploratory conversations, and that's it. So I do want to do a little bit of history, too. Does anyone know when the current SEBAC contract started? Jean, you're not allowed to answer. We all know Jean. It started in 1997, 20 years ago. Can anyone guess what the cost for the family health care plan was then? It was about $3,900. Anybody want to guess what it is now? It's over $30,000. 6 times more. That's more than inflation, folks. And we really have not contributed a lot to that. Does anybody want to guess what the life expectancy was? This is a good place to ask. In 1997. It was actually 75 to 76 years old. And what is it now? It's actually 80 to 81, depending on the survey. So there's a 5-year, we have increased the life expectancy by 5 years, which means if you're looking from the state side, we're paying that much more, 5 years. And remember, it's not members, but also if you have a spouse, it's the spouse, for 5 more years. And in addition to that, we're paying the pension for 5 more years. I cannot imagine what the cost of that is. but we know it's a lot. And the state is having a hard time catching up with that. So would they like us to contribute more? Yeah, they would. And somebody sent me an email that said, yes, but I'm already paying for that health care and retirement. Remember in 2011 when you made us pay that 3%? I'm already paying for that. And I hear that a lot. And yes, you are contributing to it, but let's be fair, it's a portion. So let's do a little bit of math. And I was not a math major. The average state worker retires around 60. Medicare does not kick in until 65, which then gives the state a little relief because it becomes a wraparound service. But they have to pay for all of those costs between 60 and when Medicare kicks in, correct? We now pay, and it's actually not 3%, because if you remember the first year we paid 5%, the next year we paid 1.5%, and then we paid 3% after that. So it really works out to 2.65%. Now if the average person, which they don't, but if the average person has a salary of $100,000, that means that they contributed $26,500. And what did we just say a family plan cost? Over $30,000. So we do not pay for that extra retirement. We don't come close. So again, are they looking for us to contribute a higher percentage? Yes, they are. I've also heard comments that you keep changing my benefits and they keep getting worse and worse. I have to disagree. I actually think our health care plan, and it has been stated, is one of the best in the nation. It has not gotten less and less. Have we asked more on the pension side and retirement? Yes, we have. I also want to be really clear about one thing. As we go through this legislative session, it's sometimes difficult to know who our enemies are and who our friends are. We found that out during the budget last year. And we're doing a lot of work trying to make sure that we can point out who our friends are. But our enemies are not the ones that are saying, hey, could you contribute a little bit more? Our enemies are the ones that are saying you should not have those benefits at all. Instead of having HEP, our enemies want us to have HSAs. My friend Ed had a heart attack last time, or heart episode, sorry. And he was in the hospital for a day. And I'm going to guess, I really have no idea, but if it cost $25,000 for that one day, if we had an HSA that only covered up to $12,000, he would have been responsible for that other $13,000. That's a big difference than saying, hey, could you contribute another percentage to your health care? So our enemies are not the ones that are saying, could you please help us out and make us or contribute a little bit more? They want to change everything. The same thing with the pension. Our enemies are not the ones saying, hey, could you do anything to contribute to the pension? Our enemies are the ones that are saying, you should not have a pension. You should have a 401k, just like the private sector does, right? Even though studies have shown that our pension is cost effective to the state versus a 401k, they don't care. You shouldn't have it because nobody else has it. Those are our enemies. So let's be clear when we're watching, listening to the news, what people are saying and how they're saying it and who our enemies are. And there is a significant distinction, and we all have to recognize that. So I did receive some questions from Bill, and I think we can now discuss them. Are we going to have to pay more for health care in our retirement? If you would like to extend the contract past that 2022, yes, we are going to have to give up. What is that going to look like? I don't know. I will be completely honest with you. When we started having these exploratory conversations, the state came with us, kind of like with the Chinese laundry list, and says, hey, could you pick 5 of these, and could we work this out? We don't know what that looks like, and we don't know what that costs. We are still in the process of exchanging data and ideas and saying, hey, how much would this save the state? How much would this save the state? And we're still waiting for that information. So I can't give you any specific information about, hey, will this part of the healthcare change, or will this part of the pension? We're not even there yet. We're not even sure if we will ever be able to start those conversations, because if we talk about the process right now, the process is, of the 15 voting members of SEBAC, and I'm one of them, we would actually have to have a majority of people say, yes, I want to start negotiations. That may not happen. We have a couple of units that do not believe that we should be opening SEBAC negotiations at all. Should that happen, though, what would happen? We would start negotiating with the state. We would hopefully come to some type of agreement where they know that they need so much money, we know what we're willing to give up to make sure that we can extend that contract, maybe get things like no privatization, I know that would be great here, job protection, things like that. So if we can come to an understanding that we can give the state so much money and in return for what they want, we would bring a deal, and that's where you would get to decide. Now, I think we all remember 2011. I would hope that we would be more transparent about what we were asking for. It would be easier to understand, and people would get to make their own decision of whether they feel it's a good deal or not. If we meet the criteria of the Constitution and bylaws of SEBAC, then it would pass. If not, it would not. So that's the process as we go through. You will have a chance to say whether you want this contract or not. So, will Tier 1 people be affected? If you're talking about health care, yes. Any changes to the health care program, they also have those changes. If you're asking, will they be required to work past 55? Yes, and because if they're still working, they're past 55 already. Let's be fair. Retirees. Will those who are already retired be grandfathered in? And the answer is yes. When you retire under the guidelines set at that time. And that's what you have for the remainder of your retirement. When you retire, they can increase your benefits or give you comparable, but they cannot decrease your benefits. For example, in 2011, when we went to the UHP plan, we offered it to retirees, and they could take it voluntarily, but they could not be made to take the UHP plan. If we go forward and we feel the UHP and we can actually prove it's a better system, then we can force it on them. But if it's only something that, if it's a benefit that they do not feel is comparable or better, they are not required to take it. If I retire now now and any possible agreement, what happens to my benefits? Again, if you retire before we came to an agreement, you would retire right now under the current rules. What happens if I retire after the agreement is reached and ratified? What ended up happening in 2011 was there was a 30-day window, I believe it was 30 days, after the contract was ratified, when the state said, listen, if anybody wants to retire under the old rules, it's a one-time, irrevocable chance to retire under the old rules. Can I guarantee they're going to do that again this time? No, I cannot. But that has been their past practice, that they give people a certain window in order to maintain the same retirement benefits before the new retirement steps in. What about the SAG award? And I'll be honest, I'm not as up to date on the SAG award as I should be, but Jean is in the back. I have been told that the magical date is now March. But of course, they've been telling to us for years, so I'm not sure what's going to happen. Thank you so much again for